I went to my doctor initially because I'd had uncontrolled nosebleeds, was feeling incredibly tired, and I don't just mean, you know, like you've had a long day. I mean waking up in the morning and just feeling exhausted, and I went to my doctor thinking, oh well, maybe I'm just a bit anemic. I had my first bone marrow biopsy, and it all started to be pretty horrid. I can remember in that meeting the doctor turning around to me and saying, well, actually what you've probably got is something called MDS, or myelodysplastic syndrome. And my wife broke down. I'm sat there going, okay, so what does that mean exactly? At that point I was told that I needed an immediate bone marrow transplant if I was to live. I was visibly deteriorating as each week went by. I was breathless, I looked awful, I was a nasty shade of grey if I wasn't just deathly white. I'd had to stop work because even working from home I was finding it was difficult because I just couldn't concentrate. I went into King's College Hospital for transplant on the day of our 25th wedding anniversary. Following day, first blood test post leaving hospital, and my blood results came back, and I had a blood count of neutrophil count of 0. I had no graft, and I can remember saying at the time, I think you must have the wrong results, you must have someone else's results, because I didn't feel sick, I just felt a bit tired. 24 hours later I went down with a neutropenic sepsis. I was rushed into hospital, and the local hospital immediately put me on massive doses of antibiotics and antivirals, and a day later I was taken by ambulance to the high dependency unit at King's College Hospital. Now my donor, he was asked a second time to donate again, and he did. I was back into that cycle of waiting for the blood results to come back, and I knew that after about 14 days it would start to pick up, and then it would double, and I'd be well and home. And it never happened, it never got off 0. I went through about 2 months where I was not great, I had no immune system, and I can remember talking to the consultant and saying, please don't leave me like this, because I didn't think I was going to last till Christmas. So I was writing down what I wanted at my funeral, things like that. They eventually they came back to me and they said, look, we've been in touch with consultants in North America, and we've discussed your case in some depth, and we're going to do a rescue transplant. So they tested my then 15-year-old son, and he was a 50% match. My son, on November the 3rd, 2010, donated his stem cells. Yeah, he donated his stem cells, which ultimately saved my life. I was still having a few blood transfusions and stuff, but I was taking 38 different tablets, you know, everything from anti-rejection pills to antivirals, antibiotics, you name it. I didn't really start feeling what I would describe as normal till about the end of February, beginning of March of 2011. It just picked up, it got better and better, and yeah, I felt pretty reasonable, so I went back to work for just half a day a week, and then half a day a week became 2 days, became a full week, and by the end of 2011 I was effectively back at work full time. Without telling anyone, I somewhat stupidly applied to run in the London Marathon in 2011. Now, they turned me down, thankfully. So I thought, I can do this, I'm going to do it again. So I entered the London Marathon again for 2013. So ran the marathon, and you know, I think that was probably the most uplifting day of my life. After the birth of my children and my wedding day, it was just awesome.